All right, Good Friday morning. It is our first rainy fall weekday, so hopefully this is bringing you some comfort with your coffee whenever you're viewing it. We're going to talk about a bunch of different things today, and we'll get right into it right now. The first impacts of the federal changes that were signed into law under HR 1 in July are starting to hit Wisconsin. And if you've been following these webinars for the last several weeks, we have been talking about food share and the various changes that were made as part of HR 1 that are going to mean states have to do more things that they're not doing now, which increases costs, and cutting of some federal money that the feds are paying right now and shifting those costs to states. Both of those things, more increased costs because the federal requirements are changing, as well as decreasing the amount of federal dollars used to actually run and operate the program, mean that the state now has an imbalance in its budget. The money that the state thought it needed to run food share as of July 4th, which is when we signed our state budget, is not correct anymore. And that creates an immediate problem for Wisconsin's food share program, because it means that the state legislature, who passed their budget July 4th, now has to decide whether or not they are going to add more money to keep running food share the same way, or to not only the same way, to keep running food share the way the federal government wants it to be run, and minimize the error rates to avoid even bigger financial penalties later. So just a little bit of a reminder of why this has become a very urgent moment right now. So July 4th is when when the federal law changes occurred, and SNAP, some of the most significant changes, including greatly expanding who has to prove that they are working to or exempt to continue to be able to receive SNAP. Those changes went into effect the date the bill was signed. And the states have been granted like 120 days of a grace period, but the reality is that there's certain changes that are supposed to be in effect now. And states have not received any further guidance from the federal agency, USDA, that oversees the program. So that's been there for quite some time. We know that when it comes to how many more people have to prove they're working and how much staff needs to verify all of that information, that is part of the extra work that really county income maintenance workers who also deal with Medicaid applications and renewals will have to do. We know, or have an estimate of, who are the greater number of people that are now going to have to prove they are working. And there's kind of 5 main categories. First of all, there are many more older adults that will need to prove they're working. They increased the age range up to age 64. They added about 10 years. It used to be 54, and now you have to prove you're working all the way up to 64 if you don't have a dependent, I believe, under age 14 in your household. So that's a big group of people that by age are no longer exempt, who used to be. And then there are 3 groups of people who were exempt from these requirements before and now who are not. And that includes veterans, homeless individuals, and youth aging out of foster care. So those 3 groups of people who used to be exempt, who are not, and you add those folks in to the number of people who will now have to do something different and where workers will have to do more work for those folks. The other groups of people that come in are people who were exempt from the requirements by virtue of the area that they lived in did not have enough jobs. There used to be geographic waivers where if the county that you lived in had a certain unemployment rate, then everyone within the county didn't have to do those work requirements because there weren't enough jobs. They significantly increased the threshold for what counts as an unemployment rate. We talked a little bit about this over the last few weeks, but it essentially works out that places that had a geographical waiver no longer will have one. So about almost 44,000 more people will have to prove that they are working and get that verified in order to continue receiving SNAP. As of July 4th, essentially. October 1st, which is now in the rear view mirror, we're in October 10th now. Another critical thing happened where the threshold for what's considered a mistake or an error changed and it was lowered. So there are more things that will be counted as errors than before. And that is really important because under the bill, there was a second provision that said if states have too many errors, then you start to have to pay state money as a match, as a penalty in order to get federal dollars. And so for states that have an error rate that is under 6%, which Wisconsin currently does, we have an error rate of 4.4%, then you don't have to pay anything. But if your error rate is above that, all the way up to 15%, then you have to start paying a lot more in. And if you have too many mistakes, what it would work out to be for Wisconsin is that you could see up to about $200 million in extra state money being having to be provided to keep getting federal dollars for SNAP if your error rate is too high. So it now is becoming really, really important for us to have the workers and the system running well and doing a good job and making as few mistakes as possible at the same time that we're also adding more work that makes mistakes more likely. November 1st, which is coming up, is that deadline where everything starts being, we know that is the end of the 120-day period that USDA says states had to be in compliance. And that means that all of the provisions that went into effect July 4th, including those prove you're working or exempt requirements, are in effect. And any mistakes or non-compliance gets counted as errors. So you can kind of see that we are in a real position where without additional workers to do the required work, we are actively putting the state at risk of having more mistakes that will result in not only potentially people losing their food assistance, but also putting the state in a position where they may have errors that start to be counted against it in a couple of years that will create an even bigger budget hole later. And then the last change that is now coming up pretty quickly is in January. And that's when the amount of money that the federal government currently pays states to help them run and operate SNAP is reduced, and by a significant amount. Half the federal funding that is being provided to the state to run their SNAP program will go away as of January 1st, which creates a really big budget hole immediately. We do not have the same amount of money that the state thought we were going to have to run this program because a good portion of the money that we expected to have was federal funding that is going to go away. So what do we need? The Department of Health Services has our Wisconsin Department of Health Services has done some estimates based on the data they have to try and figure out, okay, how many more people do we need to do the quality control to avoid errors, essentially, and how much would that cost? How much money do we need to make up for the federal funding that is going away? And how much money do we need to make sure that all of those people who now need to prove they are working, can get in our current work requirement system in SNAP? Because SNAP does have existing work requirements. It's just that they are changing and now being applied to more people. So these are pretty big numbers. All total, it's almost $70 million more dollars that is needed, more than what we thought we had to pay in July. And I've kind of broken it down into these categories so that you can kind of see, okay, here's the volume of work that we are adding on and how many more workers we need, that we think we need to be able to accommodate that work, and how much it's going to cost. That's $16.1 million. And investing that $16.1 million really can be seen as an investment to prevent errors that could cost us more in the future. In other words, if we had an error rate that was too high and we had to start paying state money in order to keep receiving federal dollars, the upper threshold of what the state would have to pay is more than $200 million a year. So it's really important. And right now we pay zero. So it's really important to keep us in the category where the state doesn't have to pay state money. And investing at this rate of $16.1 million is a good way to do that. So that $32.2 million, it reflects the amount of federal funding that we were expecting to get that we will not anymore. So that reflects the actual cost shift of the federal government saying we're no longer paying the same amount we used to. That's how much the federal government is essentially taking away from the state to run their program. And then all of the almost $21 million is making sure that everybody who now has to go through the work requirement program in our current system can do so. So this is an immediate ask, and verbally I will tell you that our state legislature has not been particularly active after passing the state budget in July. And that means there are relatively few opportunities for the additional money to be approved by the state legislature. And one of them is coming up next week. So it's important that state lawmakers understand how important food share is to you if you are a recipient of it, or your clients or people that you work with, because they need to know what the human cost is if this program does not work as well, or if people start losing benefits. And I'll just say that, from a disability perspective and a perspective of older adults older than age 65, so people who are more likely to be in an exempt category, certainly you are if you're older than 65, but many people with disabilities might fall into mentally or physically unable to work. That's the exemption category that people with disabilities might fall into. They don't specifically mention disability as an exempt category from SNAP work requirements, but that's the existing language that I think gets applied to many people with disabilities. What we are concerned about is if you aren't, even for folks who are exempt from the new prove you're working requirements, when you don't have enough workers to keep up with the volume of work that exists, it gets very hard for people who are, even those who are exempt, to kind of get through the door. You know, there's only so many people that can move through the door at the same time unless you start opening up other doors, and limiting the number of workers that have to do more work is going to create a situation where it's easier to make mistakes, and or people who absolutely are qualified or who are exempt from requirements are waiting because there's just too many people trying to get through the same small door at once. Organizations, there is a sign-up letter. So if you are connected to your local food pantries or local public health folks or local counties or ADRCs or county governments, you might remember that there was a call from the Counties Association to pass county resolutions on this issue. This is a great opportunity to easily sign on to that letter, and that says, hey, we need to fund these things now. There is a potential vehicle next week. There is a technical budget correction bill. The number is AB 387 and SB 390. The Senate, the state Senate, will be meeting next week. And one potential pathway is that the state Senate could amend that bill, SB 390, add the extra funding, and then it could go back to the assembly for approval. That's one pathway. If that doesn't happen, it's not the only one, but it is the easiest path to get something approved as quickly as possible. And I think what we're hearing from our friends at the Department of Health Services is that it is very important to put the money to make sure this money is secured as fast as possible, because even when you get funding, you still have to do the hiring and the training of those workers. And there's still, you know, a lot of things that need to be done to implement this well at the same time that, you know, you're running the program. So it is a matter of some urgency that people really help educate state lawmakers about why there is such a need in this moment to increase this funding. This is something that cannot wait. In other news, following up on, you know, some of the federal education grants that our Department of Public Instruction had taken back. We've been following two grants. And last week I said the $10.5 million grant that was intended to help build up the special education teacher workforce was canceled, and that our department had appealed that cancellation. We now have a final no from the U.S. Department of Education. They responded back to the request from our Department of Public Instruction to reconsider their original no. And you may remember that our DPI said, hey, you've identified some language that you don't like that's in this grant. We're willing to change the language. We'll work with you. That was not sufficient for the U.S. Department of Education. They kind of restated and reaffirmed their original decision, which was to cancel this 5-year grant that was supposed to be going through 2028. So that is again $10.5 million of federal money that we thought was going to be coming in that is now not going to be. A second grant, which was for a much lower amount, that was specifically for deaf-blind students, was also canceled by the U.S. Department of Education. However, it does seem that our Department of Public Instruction has found an alternate funding source from a private foundation that will at least allow the program to continue for the next year. Now, you might remember that this particular grant was a 5-year grant that was supposed to go through 2028. So going through next year, it does not get us to 2028, but it does get us farther than simply having a grant canceled now. So think about this as we have bought our, Wisconsin has found a way to find $500,000 from an alternate source to keep this program in place for one of the 3 remaining years that they thought they would have the money to keep doing this, but it is not a permanent fix, or it does not replace the full amount that and time frame that grant was supposed to be going through. Good article coming out focused on Wisconsin. This is a national article, but I thought it had a lot of relevance for people that we know, especially across the state. Again, the article is framed really from a family caregiver point of view. Here's a person who moved back to care for, in this case, an older relative in rural Wisconsin. And then their hospitals, half the hospitals in the area closed. And that happened, a couple years ago. So prior to anything in HR1, this article is really focused on how strained the healthcare systems already are in many parts of rural America, and it's really focused on Western Wisconsin. And so it's a good illustration of, those 2 hospitals that closed in Eau Claire, those closures are having pretty big consequences for the greater regional area, in terms of, people missing care, people delaying care, diagnoses that are being missed, and really some life and death consequences because local doctors are not able to care for more complicated people at those hospitals, and then have to fight to find space and beds at other places. So this article is making the case of, here's an example of what happened in a rural Wisconsin area when hospitals closed, where more than a year after those closures, and here's what healthcare looks like now for the people who are experiencing it and the people who work in those settings. And now we're going to have, $1 trillion worth of Medicaid cuts on top of, the current situation. So I think it's a good article to share with your networks, because it's an illustration of, how hard it is in the current systems we have and how delicate people's lives really are before we get to the point that we are adding on more and more cuts and impact. So I've updated our timeline here. The shutdown continues. We are at October 10th. That's 10 days into the federal government, furloughing almost 700,000 workers and deciding which ones were essential and which ones are still coming into work without pay. We are also not going to see the shutdown resolved, at least until the next opportunity will be next Wednesday, because the Senate has left for the long weekend, and as of this morning is not planning to hold any more votes on a continuing resolution until next Wednesday. But you can kind of see now that we're getting into a place where the consequences are going to start to ramp up. Today is will be the first paycheck that will be missed by federal employees if the shutdown continues. Next week, Wednesday, is when paychecks for the active military are supposed to go out. It is also important because that is the first day of open enrollment for ACA Marketplace plans in Idaho. Idaho is early. Everybody else follows a couple weeks later. but it does mean that, like, by next week, the failure of Congress to extend those ACA subsidies starts becoming very real for policyholders in at least one state, with other states to follow. And of course, all of this arguing over, the shutdown, remember the original continuing resolution was supposed to keep the government open through November 21st. Well, now we are, that's about 5 weeks away. So you can kind of see that the timeline here is getting crunched. And neither side is budging. The continuing resolution that was passed by the House does not have enough votes to pass the Senate. I think they have voted on that same proposal 6 times now. And that apparently will be what they vote on again next week. The US House is not coming back into session. They are essentially saying, we have passed a continuing resolution and we are going to keep our members home, so that really it applies pressure for the Senate to agree with our bill. And that's the only path to opening the government. You can't negotiate if you are not present and in session. This week, the House also said, they kind of upped the ante a little bit and said, we're not coming back into session until the government's open, which is essentially, we're prepared to stay out and not come in at all until you do, this particular pathway. The Democrats have a list of things that they would like in exchange for their votes. And that list of things has not changed much. They want to make sure that money is being spent as it has been promised. They have spent a lot of time talking about the expiring ACA marketplace subsidies, and also saying that the cuts to Medicaid could be reversed to get their votes. Meanwhile, the Republicans are saying, well, we won't negotiate on any of the things that you say are what we need to get your votes until you vote to open the government first. And we've had a variety of different comments that the White House has made to try and create leverage to open the government. So just a summary, here's kind of the 3 positions that are out there. The Republicans, meaning this, it's really the US Senate who is in control, because the House already passed the CR and they are not coming back, at least at this point, to do something different than that CR. The Senate Republicans don't want to talk about any of the ACA subsidy extensions or other things until after the Democrats agree to reopen the government. The Democrats, in their position, have said, why should we do a handshake agreement? Because once we give you our votes, there's no guarantee that any of the things that we think are really important will actually become part of legislation that will be, passed and introduced in the Senate or the House. The White House, for its part, has done said a number of things out loud. It has threatened to permanently fire federal workers instead of temporarily laying them off. They said that, really at the beginning edge of the shutdown, and it hasn't happened yet. This week, they've also said, well, all of those workers who are coming into, that we're telling have to come into work, and all of those people who were saying, don't come into work, stay away, we don't have money to pay you. Maybe we won't pay you for the time that you've been working without pay, which is highly unusual and actually is in conflict with a law that this president signed in his first term. Today, there was another statement about, we're going to take away money from Democratic programs, programs that Democrats like. That is non-specific in terms of, what programs or what funding or how much that means. But I will say that most federal programs, they are generally not, they are serving everybody in the country, regardless of, what state somebody lives in or how they voted. So it's really unclear, what is meant by Democrat programs that Democrats like, but that is another statement that has been made today. Already there have been some large amounts of money that have been rescinded or clawed back from select states, largely infrastructure money. And those states have had Democratic leadership. There's also been some comments, and I don't have it in here, about how will, now we're getting to the point where there isn't a solution for active military, how do we pay our active military? And there are certain programs that will be running out of money to operate. When the WIC program is one of them. And so there has been some, well, we're going to use tariff revenue to, meet payday for the active military, or we're going to use tariff revenue for, operating of WIC. And it's unclear if there is legally an ability to route those funds. And it's unclear if that's an actual plan or just something that's being said. But all of this is kind of in the ether. And what isn't being said is we're going to come together and negotiate, on a deal. And it also is unclear, like, once you get to the point where you are talking about how to get the government open now, what happens next in terms of all of the other things that Congress needs to do, namely approving a final federal 2026 budget and, other pieces of legislation that really need to happen before Congress leaves town in December. So there's starting to be, and for those of you who have been shutdown watchers in previous years, this is not the first time we've had a government shutdown. It is now turning into one of the longer ones. There's generally a trickle of articles that starts coming out, detailing like what are some of the consequences when the federal government, stops operating, where federal funding either isn't going out the door, or you have certain things that the federal government usually does that aren't being done anymore. So this article was pretty comprehensive, and I think focused on some of the things that are of particular concern to people with disabilities and older adults. There are a lot of, you may remember this spring, the Administration for Community Living was really significantly reduced in terms of staffing. And we had a lot of people who spent a lot of time saying, hey, this is not a good idea to eliminate this particular, division. It does important stuff, including manage Older American Act programs and also a lot of disability programs. Well, now there are very few staff that are essential enough in that division, which means a lot of the money that typically flows to states and to local organizations to run these aging and disability programs is bottlenecked. It's stopped. Social Security and Medicare benefits, those are being paid, but there are plenty of Social Security Administration staff who have been furloughed. So while the benefit checks are going out, if you have an unusual question or a problem that needs normal customer service to resolve, some of those things are being delayed or suspended. SSI should have enough money to pay benefits through the end of the year. Another important consequence right now All of our friends at the Bureau of Labor Statistics, which again also has had quite a few layoffs, they play a really important role in calculating what the annual cost of living should be for Social Security beneficiaries. That work is supposed to be based on the October Consumer Price Index. We are in October. So the cost of living adjustment could be delayed this year if the government shutdown continues. There, the Older Americans Act programs, Meals on Wheels is one of the best known programs that's funded by Older American Act dollars. And there isn't any staff at the federal level to get the funding distributed to local providers. So it's not the only Older Americans program, but it's one a lot of people know and a lot of people rely on. And it also impacts a lot of different local providers especially in rural areas. So it's a good example of, lots of these organizations that are doing very good direct service work don't have big budgets and they don't have a lot of money in reserve. They really depend on that constant flow of federal dollars to actually do the day-to-day work and keep running. And so, they're not quite at the point where they have to delay or suspend deliveries or put seniors on waiting lists, but they probably will be fairly soon if the shutdown goes on. The other big impact that was highlighted here is that, a lot of older adults and people with disabilities rely on housing assistance and rental assistance. So there's now starting to be a timeline of, well, how long will that be able to continue in a prolonged shutdown? So, I think these are all things that will start to become more likely to be heard about in the news as a lot of the money that directly goes to people and helps support them in their lives is delayed or stopped. And new this week, states are starting to worry about whether the federal government will honor their promises and reimburse states. There are a lot of states that are continuing to operate programs, including things like food share and federally subsidized meals in schools and those types of things. And often states have continued to tap into a rainy day fund or continue to pay the bills because there's an assumption that when the federal government shutdown ends, the state will be made whole and the federal government will pay the federal dollars that the state laid out in their own money to keep doing the work that the federal programs would fund. But lots of states are starting to worry that this time might be different. And I think, again, it's a pattern, it's a worry that wouldn't have been there before, except that we have seen a pattern over the last 10 months where how Congress has allocated funding hasn't always been honored. And it's been a recurring pattern, not only on individual programs, but we've seen a couple of rescissions requests, and even during the shutdown, taking back of funding that had previously been awarded for infrastructure or for education or other things. States are kind of looking at this overall pattern of, okay, should we assume that the way a shutdown has been resolved before is going to be the way, is going to be the model for how things will work out now? And a lot of states are really, really nervous that they may be paying for things that the federal government should be paying for, and that the federal government may never supply them with the federal funding to pay them back, essentially. And if they aren't reimbursed, that is again another way where states are spending money that they didn't budget for and that they don't have. And so if they spent that money and they don't get it filled back in by the feds, they are now left with a budget hole that may result in states having to do more cuts. So another opportunity for action, when you get tired of talking to your state lawmakers about the need to provide more funding to keep food share operating because of federal funding cuts, you can also feel free to connect with Congress and talk about, how the shutdown is starting to impact your local community and your local areas. There's certainly a lot of things that people with disabilities and older adults rely on daily. I mean, we are an organization that receives federal funding, so is Disability Rights, so is, our area agency on aging, and a lot of things that people are familiar with. There's some piece of federal funding maybe supporting that direct work. So a lot of organizations are going to start feeling a squeeze locally if the budget that they thought they had isn't there. And what you can tell your members of Congress, I have the switchboard number here, is just how much the federal dollars really do support the work that is going on in local communities and for some of the people who need the most help, and what they can do to make sure that the people who live in their districts are not being negatively impacted, includes reopening the government, making sure you're committing to the same level of funding for those disability aging programs in 2026, and making sure that the amount of money that you allocate for those programs actually is spent as it is expected in the timely manner. Kind of those three things are really important to make sure that budget certainty, that all of the things that we have built to help support people with disabilities and older adults can continue to operate with certainty into the next year. Meanwhile, the government shutdown discussions, a lot of the public messaging has been about those expiring Affordable Care Act subsidies. So a lot of them, while it is a bigger conflict than just Medicaid cuts and just you didn't extend the subsidies and now we're getting to a point where people are going to see their premiums increase. There's definitely other factors that are contributing to a lack of trust of Congress and wanting to put some guardrails on to make sure that federal dollars are getting to where they need to go. The subsidies expiring at the end of the year are a big sticking point. And the president of the National Association of Insurance Commissioners are not a group of public servants that I normally associate with being extraordinarily excitable people, but they are being very clear in this moment that the subsidies like the time for action for Congress is really now. And you might remember that I said Idaho is the first state that starts their open enrollment period. That starts October 15th. That's 5 days from now. That's next Wednesday. All the other states start their open enrollment period on November 1st, which also isn't that far away. So this group of insurance commissioners is saying, hey, you think you have time to act and you don't. We've been warning you about this problem for months. So if Congress says, well, this is the first time I'm hearing that this is a problem, not true. There have been multiple letters sent by this group and certainly many folks in our universe, right, who are concerned about the ACA marketplace. Like, this has been something we've been talking about all summer too. And so this idea of there's extra time to, Congress has a lot of time, the insurance commissioners say no. If we're getting to the point where letters are going out to policyholders that are showing them what the price will be, and that price has to factor in no subsidies, people are going to make very different decisions about what kind of plan they have, how much out-of-pocket costs it covers, what kind of coverage it offers. And some people are going to make the decision where they can't afford insurance at all and go uninsured. So the consequence of missing a deadline, it's not November 1st, it has to be passed before November 1st. The consequence of not acting in October is pretty stark, because as the insurance commissioners point out, once people have received their letters of here's what the costs are going to be next year, it's really going to be hard to pass something after that and then send another letter and have people understand or believe that the new price is the true price. And some of those people will have already made decisions in the early part of the open enrollment period. Congress thinks differently. They think they have all the time in the world, that this deadline is really the end of the year, December 31st, and that's it. Something has to be done before they actually expire in the law. There's also some discussion of, well, maybe there's some leverage to extending the subsidies, but the subsidies might not look the same as they do now. So adding to the uncertainty of whether subsidies will be extended at all, because there is a fairly large group of members in the House that don't think that the subsidies should be extended at all. There's also the question of, if it isn't a clean extension and you change who can get the subsidies or how much they're worth, that actually adds confusion to people who are trying to make decisions about plans, because it becomes less clear, about what you're getting now. Is that going to be the same or different in the future? And it is a strategy sometimes to use a deadline and come as close to that deadline as possible, so that you may get credit for doing the actual action, but you've delayed it long enough that some of the negative consequences have already occurred, that you've acted too late to avoid the, in this case, damage to the risk pool that occurs as people make different decisions about which plan or whether they have a plan. So this is a similar question as other weeks, but I think, again, it's becoming more urgent. Next week, if you lived in Idaho, next week, Wednesday, you're getting a letter telling you what your plan is going to cost without those subsidies. And for other states, open enrollment begins November 1st, so they may be getting letters, a little bit before that. So that really means October, like the next week or two, is kind of the window to do this. And it's, I think, relevant to ask Congress those questions now. This week, there has been reporting about, again, some changes to administrative rules that might change how who qualifies for SSDI benefits. Now, this particular change actually is an idea from the first Trump administration that didn't make it all the way through the process. So it is not a new idea, but we are now in a place where there would be time to make these changes. And so they're kind of dusting off a proposal that they had some years ago and bringing it back. And there are a couple of things that are perhaps positive here. One of the challenges with qualifying for SSDI is that you have to kind of prove that you aren't able to do any kind of work, and the database that they have been using to make those determinations is really outdated. It has a lot of jobs that really don't exist, in any quantity anymore. And there was, a couple years ago, a pretty big investigative reporting piece that was pointing out that the jobs database was so out of date, it was becoming a way and a mechanism to find a way to deny disability insurance simply because you had a database that was almost deliberately out of sync with the actual, what the workforce looks like now. So one of the changes that this rule would do would be to update that database. And that isn't necessarily a bad thing. But some of the other changes might really impact who's able to qualify for SSDI. Currently, one of the ways that they evaluate disability claims is to consider age. And a lot of times, older applicants, people over age 50, have a better chance of qualifying because age can be a limiting factor in adapting to a lot of different kinds of jobs. It's also true that people acquire disability, especially folks who, experience injury or have chronic or progressive conditions that lead to disability. A lot of times there's a group of people in their late 40s, but well before retirement age, who are acquiring new limitations that may impact their ability to work, that are health related and often disability related. So this proposal is thinking about doing one of two items, either eliminating age as a factor at all, or saying, well, we're not going to consider age being a limiting factor to work unless you're age 60, or 5 years away from what is currently considered retirement age, right? 65 is currently considered retirement age. And that would significantly change, potentially how many people would qualify for disability. There is an idea out there, and again, this idea isn't necessarily wrong, that there are lots of jobs that have changed and fewer jobs requiring manual labor, so that there are lots of people who can continue to work even if they are not physically able to do manual labor. Like, I think that is a statement that most of us would agree with. And we certainly, as we've been, trying to promote the idea of people with disabilities being an engaged part of the workforce, we have been very much thinking about what kind of additional work options, would be possible for people if they have the right supports. So if you think about, there are more jobs that people with disabilities can do, that can mean more work options, but it also would mean fewer people being granted disability benefits. Those of us who have done a lot of work in disability employment, however, and our friends at DVR might agree with this, that while there are additional jobs that could be accommodated for somebody with a disability, they also frequently require accommodations like remote work options. Somebody has to be able to have the technology or the internet connectivity to do some of those jobs. If there is a requirement that people be present, affordable, accessible, non-driver transportation is pretty much not available in the quantity needed for to actively support a lot of people with disabilities doing those jobs. And those barriers, are things that exist right now that are often the difference between a person with a disability having a job and have not. So this idea that there should be more jobs that people with disabilities can do because there's less manual labor, that might work, but only if you also have all of the accommodations and supports needed for those people with disabilities to be able to participate and actually find a job. At this point, a lot of the older Americans who apply for disability benefits don't end up getting another job. And there can be a lot of reasons for that. You know, just the availability of jobs in the area in which they live, you know, the ability to adapt, some of those barriers that we just talked about if they're acquiring new conditions. So it is likely that if this rule is changed and doesn't consider age as a factor, there would be more older disabled workers who wouldn't get disability benefits and might have to take retirement, which means that they take a permanent reduction in benefits for the rest of their lives. There aren't estimates about how many people these changes would impact yet. But there are, you know, some folks that are doing some back the napkin math, and you can see that if you reduce eligibility by even as little as 10%, it translates into many fewer people receiving benefits at all for the next decade, and a lot less federal money paid out if there are fewer people receiving benefits. Yesterday, we've spent some time talking about earlier this month, there was a press conference that was really focused on autism. And there were lots of things that were said at that press conference, including a statement that Tylenol taken during pregnancy causes autism. There are not scientific studies that show that that is a cause and effect. Yesterday, that statement was repeated by our Secretary of Health Services, and another cause of autism was said that you know, boys that were circumcised early, that there was there's some idea that that is again causal to autism. So it's hard to know how to talk about this. This was not what I was planning to say early this morning, but I think it is important to note that this was a cabinet level meeting, and that the person making the claims did note that they did not have medical proof to substantiate what they were saying. And, you know, again, it's another example of, you know, introducing a very simple cause and effect relationship to a disease where all of the research, not disease, autism has many different factors that contribute to the diagnosis. And you know, this is again a search for a simple cause and effect. And I think it's important because oftentimes what people want to know is what are the things that I do or don't do to prevent this outcome or change this outcome. And lots of folks who are listening to, you know, these statements are looking for those instructions, like what do I do or not do, or what have I done or not done that has caused, you know, an autism diagnosis. So it's again another example of a continued messaging about that is really not rooted in any quantifiable science. And it's also another example of how the messaging of there's a simple cause, and if you do something different, then, you know, we will be able to prevent this kind of person, is continuing through this, you know, well after the press event earlier in September. There's also, you know, not everybody here is a mom or has autism, but I do think there's a theme that's important. Blame is often a technique or a tool or something that underlies a lot of public policy. And when you hear kind of these simple relationships proposed, well, if you did this, then that's the result. Or if you didn't do this, then this is the result. That is a structure that says the behavior of an outside individual is a reason to um, decide whether or not we want to help that person, right? So whether it's an individual or a family, if you can find somebody to hold responsible for the condition or the circumstance, then you can decide whether or not to provide help for a condition that you can blame is the result of somebody else, right? And that's important from the standpoint of, we spend a lot of time in a lot of space talking about who is vulnerable or not, who is eligible or not, who is worth helping or not. And this is one of the concepts that underlies a lot of that kind of thinking. And when you have programs that are trying to figure out who is it that we must serve versus who can we choose to serve or choose not to serve, or how much money do we have to spend and who do we spend it on, these kinds of constructs of, can we blame somebody's behavior for causing the condition and then make that a reason to not include them in the pile of people that we're serving becomes pretty relevant. So this article kind of goes through some of the history, particularly with autism, but I don't think exclusively so, about how, how long this, this kind of pattern of trying to look for a simple cause and effect in a person that is responsible has been going on. So you can see there's a 1943 paper. This is a long time ago, going through the 60s, in the 90s. And in our current world, we still have some of the same kinds of ideas, again, looking for a simple reason to identify for what was perceived as a problem. And there are lots of people with autism that would not describe their existence as a problem. They would just say this is just how it is. And it isn't particularly helpful to focus on, why or who's to blame for how I am. I just am. But I think in this moment, it's important to just kind of remember that this is a pattern that has been around for a really long time. And I think when you have people in leadership positions that are kind of re-emphasizing those messages and keep adding, well, here are different simple things that maybe everyone has done or is likely to have done as a reason for a condition that you are portraying as negative, that kind of ramps up this idea of, well, who can we exclude? Who can we decide after the fact should or shouldn't have help, or determine what it is that they have to do or not do to get help. This particular article is an opinion piece. It's written by somebody with autism, but it does talk about, two terms that disability folks use a lot, like the medical model of disability, which tends to view people through their disability as the disability is a deficit or a lens. And I do think this person is pointing out that a lot of the messaging that we are hearing from leaders right now is very solidly in this idea of a medical model where, the people with disabilities are being described by their limitations, and the idea is to solve the problem of and solve those things so you don't result in those limitations, as being very much the old model of disability. There's a different model, and it tends to be where disability advocates and many families have been, which says, well, yes, disability is a difference, and it is the person's experience. It is normal for them. We have not designed a world that has oriented itself around disability as being a normal part of human existence. And then, deciding how do we navigate through the world, looking at how do we improve the environment to make it easier for people who don't fit the mold that it was designed for. And there's a real difference, again, with blame of the social and the medical model. So thinking about, how the medical model is framing disability and where they're putting their emphasis in research, is where this particular author is going and saying, hey, this leads down a path that is very far away from the social model of disability. And some of our policies, like the ADA and the IDEA, which are trying to figure out how do you get people more included who do not fit, do not fit the way the world was designed. The Supreme Court is about to take on a case, and this is a death penalty case. So, not necessarily, but it's a death penalty case that relies on whether or not the person in question has an intellectual disability. Because if they do or they don't depends on whether the death penalty can move forward. And I believe this is a case in Alabama that Alabama is bringing. So national advocates are again raising the alarm about this particular case because they are worried about a decision here actually being much more broadly applied to lots of different kinds of cases. And it's really about how do you determine whether somebody has an intellectual disability? And kind of an old idea is that you do an IQ test, and if it's below a certain number, that means you have an intellectual disability, and if it's above a certain number, it means you don't. That's a really old idea. It's still on a lot of statutes and other books, and there's been an evolution over time about how people who make diagnoses think of disability, and they've kind of moved away from one quantifiable test and score, and developed a much more comprehensive framework to determine intellectual disability. And that approach evaluates, really things from limitations and functioning and adaptive functioning. It isn't only about, a certain result on a test. It's kind of the whole, how well can the person engage, overall. So the reason why national advocates are concerned is because the case would like to go kind of back to the old rules where simply an IQ number is enough to determine whether or not somebody has an intellectual disability. But that way we define intellectual disability actually matters quite a bit. Again, who gets into a program, who doesn't. If you are a person who needs extra support and education, or home community-based services, and those programs are for people with intellectual and developmental disabilities. If you change what is considered an intellectual and developmental disability, or you measure it very specifically and differently, that is likely to mean there are fewer people who are going to meet a much more rigid standard. So determining intellectual disability, again, only based on IQ scores, is likely to leave out a lot of people who need extra help and who, might be considered a person with intellectual and developmental disability, and as a person with intellectual and developmental disability might be, covered under different programs or part of, part of different communities. So it's an important case to watch. And the reason that national advocates are watching it is because they don't see that they see that this particular way that states want to define who has an intellectual and developmental disability could be really impactful in terms of, how they decide, again, who gets included in programs that are designed to help intellectual and developmental disabilities. We have not talked much about some of the smaller provisions in HR 1 related to Medicaid, but this was a particularly important article, and it looks like a small change again. States are going to be required to verify addresses of medical beneficiaries. Okay, that seems simple enough, and it's going to be implemented, or it needs to be implemented again, January 1st, 2027, which you might remember is when several other provisions also go into effect, including shortening the amount of time for retroactive coverage and when prove you're working or exempt requirements for Medicaid will first go into effect. But this article does a good job of pointing out that that kind of simple idea of requiring states to verify addresses of beneficiaries is actually much harder to do in practice because there are some groups of people where there may not be a permanent address, or that the address that they use may be an address that is used by many people. And specifically, there are lots of people who have unstable housing or who are homeless or who are somehow engaged in a state system like child welfare or corrections, where the address that they have or use might be a formal, like, office address or PO box or something, where if you have hundreds or thousands of people who are all using the same address, it might look very weird. I think also another group that the article doesn't talk about, but probably is in this category, a lot of tribal members, especially if they live on a reservation, which may not have formal addresses. This is another group of people that would be, at risk of losing Medicaid benefits simply because the state might not see their address as verifiable. And people with disabilities are really overly represented in all of the categories that this article talks about. Lots of times, anybody who has housing instability, we're not only talking about people who move quite often, because that's a scenario too, renters who might move every 6 months or have very short month-to-month leases, for example. But there are lots of people who, may be living with certain, different family members, and maybe that changes from week to week. They might be couch surfing with different friends or family members, or be actively homeless. Lots of those folks are either going to, they're going to use a last known address, or and maybe the mail doesn't catch up with them, right? They may have moved on before that address, by the time the mail gets to them, they've moved to a different address. And there's also a lot of people who are homeless that, don't have a physical address. They might be using even like an ADRC as their primary mode of contact. So any of those addresses that have where it looks like there are lots of people there, if states aren't careful, they're going to look like they're invalid Medicaid, invalid addresses to Medicaid staff. And so there's got to be some thought put into how do you do what seems like a relatively simple administrative task. It turns out it's not as simple when you look at the realities of people's lives. And, problem solving, how do you account for people who are transient and, still eligible for benefits but aren't in the same place, or people who may not get their notifications because they've selected a central point that they may always not always be able to get back to, that is not a permanent residence. It is actually more complicated. The same is true for kids who are, in state custody or in the county child welfare system, depending on the state you're in. Youth transitioning from foster care, another group that is often in unstable housing or homeless. All of these groups kind of fall into the same pot of challenges, which is, they're moving from one place to another, and does the system, track them in real time and catch up? And what happens when it doesn't? This article is focused on Colorado, but it's relevant again here. We've kind of been talking about, the extra work that counties in this state too will have to do to implement some of the food share and Medicaid changes. So it's a really good article in terms of, like, what are the practical realities that a lot of these county workers are going to face with people who they know in their communities, and that there isn't actually administrative money that is, built into the law to help implement these changes. Like, this is all going to be extra cost that isn't budgeted for now, that state and local governments are going to either have to figure out, or they're not going to make those investments, and it's going to have pretty big consequences for the people who, again, need to get through the process in order to keep their benefits. And in Wisconsin, it's the county income maintenance workers that are administering both the SNAP and Medicaid eligibility and application programs. So these are the workers that have a lot of program expertise, and they do a lot of detailed work to get people through the process and make sure that everybody who's applying is eligible and verifies that they're eligible to receive those benefits. These are the people who are about to get a lot more work, like now, for all of those people who in SNAP who now need to go through and do the prove your working process that didn't have to before. And these are the same group of people that, when Medicaid changes happen, will have a lot of other additional tasks, especially when it comes to new prove your working or exempt requirements. So this is just kind of a little bit of a shot of, like, what are the tasks that this group of folks actually does. And as our friends in the counties would say, these workers aren't just, they're not just widgets. These are people with actual real expertise in these programs, and they have a lot of customer service and a lot of, knowing the right questions to ask. These people can be very, very helpful to individuals who are trying to navigate tough systems, and they're the ones who are going to have a lot more work to do because of changes in HR1. And unless, like, our state legislature decides to invest more in making sure these programs run well, too few people doing a lot more work is a kind of a recipe for mistakes and people who are eligible not being able to get through the door. And last slide, we've been talking about North Carolina for some time. There are several states, not only North Carolina, that have made cuts to their Medicaid program before the cuts in HR1 come. Colorado's on that list, Idaho's on that list. There's several other states in the process of, their current budgets that are making decisions. And in all of these states, they're choosing to cut state money, which again reduces the amount of federal Medicaid dollars coming in advance of cuts that they are anticipating will have to be made as HR1 keeps implementation continues. And I've posted the link to the actual letter here. There isn't a lot of new news here, in the sense that the amount of money that's being cut is known, $240 million. and the amount of reduction in rates for all these services is known. That's been known for a month. But and a lot of these services are directly related and important to people with disabilities. So that whole argument of it won't impact you, or this won't impact this, we don't want to impact vulnerable people. This is really a case study that shows, no, when you start having to cut chunks of money out of your Medicaid budget, you are going to end up impacting, people with disabilities and older adults, simply because that's you're reducing money on the services that they also use. So in North Carolina, personal care, the traumatic brain injury waiver services, intermediate care facilities, these are all services or places that receive money that provide direct services to people with disabilities. And I think my purpose of including this here is not to say anything new, but just to remind people that the questions that you've been asking since really February of this year, of how is this going to impact my daily life? I know exactly what I have right now. And for a lot of us, we're kind of barely hanging on and we're making it work. We're making it manage. We're making it manage. And we know that if any one little thing changes, the sands shift, the house of cards falls down. Like, people have been very, very clear about, we know what our life looks like now, and we know that if any one of these little things changes, it all falls apart. That has been the question that people with disabilities across Wisconsin and across the nation have been asking. And this shows you that even when you know how much is cut, even when you know what specific services are impacted and by what percentage, it still doesn't answer that question. People will not know how many dollars have been cut for specific services by, and they won't know how these cuts will be implemented. They won't know how the providers that they're working with now will be impacted, whether those providers will choose to take non-private, more private pay folks and not serve as many Medicaid folks, whether those private providers will be go out of business entirely or be bought by a bigger group, or choose to serve Medicaid patients that have fewer needs rather than more. They have no idea, even at this point, when you know cuts are happening and you know which services and you know by how much those things are being reduced, what it will actually mean to their individual care plan in their daily lives. That doesn't give you a lot of comfort, but I want folks to know that the question that you have been asking since the beginning is still the right question. And it is not knowable until after the damage has already occurred in many cases. That, all folks are going to end up, if there are cuts, figuring out what they mean to their daily lives after the fact. And that is not the right place to be able to advocate, for things to be restored. So that, all of the work you've been doing this year has been really important, but there's also a lot of work to continue to do to make sure that, the choices that states are making are going to be the best choices in terms of making sure that there are the fewest number of people who are the least impacted when it comes to how the cuts are ultimately impacted. And with that, I am going to stop sharing my screen.
There were very few questions and they got answered this week, Tammy.